Members of the committee, thank you again. My name is Bobby Savoie. I'm the AARP Louisiana Volunteer State President. I live in House District 71. My representative is Buddy Mincy Jr., just so you'll know that I am truly a constituent of someone, although not necessarily on the committee this morning. I appreciate the opportunity to appear before you today to comment on fiscal year budget 22-23. So AARP Louisiana has over 448,000 members across the state, and we advocate for those and others who are 50 plus, whether they are members or not, the age 50 plus. Our commitment is, among others, to help older adults live independently and in their communities when they can, for as long as they can. So if you're a reader of The Advocate, as I am, not necessarily every day, but something in yesterday's editorial caught my eye. And that editorial talked about the sale of a Louisiana company, founded in 1994. So the interesting piece about that company is that the owners volunteered to help their local seniors who could no longer care for themselves. And this is about care at home, again, for those who can stay at home with just a little help. So let me talk just a bit about that company. 30,000 employees. Remember now, it was formed in 1994 in St. Leonard Parish, and it grew to 30,000 employees in 964 locations in 37 states with 12 million annual in-home care visits. So I can also tell you the company had $2.2 billion in revenue last year, and the sale was for $5 billion. The only point in me mentioning this is that the model of caregiving is changing across the nation toward home services. Our surveys and surveys across the country continue to validate that our elderly and disabled want to stay in their homes if they can, for as long as they can, with a little help. AARP supports quality long-term services and supports in all settings. However, as you know, nursing homes, assisted living facilities, and other congregate settings have presented special challenges because of the COVID-19 pandemic. So why am I here? I'm here today to ask for that little help and to request the committee to please fund 250 new waiver slots for Community Choices waiver to be included as part of the Louisiana Department of Health Office of Aging and Adult Services budget in the next fiscal year. Currently, there are nearly 8,000 seniors and adults with a disability on a wait list to receive this Community Choices waiver. Unfortunately, it takes an average of 10 years to receive this waiver. So you know what happens when you wait 10 years for anything. You may not be here to receive it. So I guess that's one way to get off the list. I think we all understand this is far too long. Now, more than ever, we have the opportunity to begin to eliminate the wait list, and we can use your help to do so. Giving the choice will allow many the opportunity to remain in their home and their community. In conclusion, I humbly request that you consider the needs and choices of our Louisiana citizens, our family, our friends, our neighbors, and fully fund these additional 250 waiver slots for the Community Choices program for older adults. And that's my story.
Thank you, Bobby. Appreciate you coming. Let's see. Representative Bakla, is this for Bobby? Question? Yeah.
Thank you. And real quick, what I had to step out to take care of some other stuff, but what is the amount you're asking for?
Well, it's to fund 250 waiver slots, and Andrew has that the answer to that question.
Yeah, Andrew, go ahead. And state your name, please.
Hi, good morning. Andrew Mull, Associate State Director of Advocacy for AARP. to echo what Bobby said, we're asking for 250 Community Choices waiver slots that would go into the budget for the Office of Aging and Adult Services. And we spoke with them earlier in the week, and the cost for those 250 waivers to be fully certified for an entire year is about $6.5 million. And that's for a 12-month period of time.
If I may ask, for each of these 250, do you have an idea of if this program's not available? Obviously, the other step is nursing home or whatever you want to, right?
Correct.
What percentage of these would stay home without the service as opposed to taking advantage of this program? I mean, I'm just trying to figure out, if we don't give the 250, does that mean 250 or 150, or what number do you think?
It's hard to say, but currently those individuals are probably being cared for in their home with family caregivers who are scraping by whatever means they have to allow them to remain at home. But some of them will end up requiring institutional care. So this would allow them to remain in their home. And these services, these Community Choices waiver services that Bobby spoke about, provide very simple assistance in their daily life. Things like bathing, grooming, maybe some simple skilled nursing, transportation, just very basic services that allow them to stay in their own home, so they can remain independent and stay in their own home and community.
If nothing else, it would probably delay going into
absolutely
that next level of care, correct?
Absolutely, yeah.
Comparative cost between the two, what would it be?
The annual Medicaid cost for nursing home care in Louisiana is about $63,000 per year. Average cost annually for a Medicaid Community Choice waiver is about $25,000 a year.
So, in reality, investing $6.5 million in this program has the potential to save maybe that much or more in overall cost to the state, right?
Absolutely, yes, sir.
So this makes good sense that we would offer this the option that's more appealing to the person and less costly to the state. So it would seem to be a win-win. I know others may have a different opinion, but I think that would be my conclusion.
And that seems to be the trend across the country, to move to, not taking anything away from institutions or facilities, but allowing people to continue to live at home as long as they can. I mean, it'll get to a point where maybe they can't stay at home, and then they've got to do something else.
No, I think there's an obvious next stage. I mean, people can't stay, even with home health, they can't stay at home forever, or not everyone can. But we ought to at least, the quality of life, I think, most of the surveys that I've seen is that most people would prefer home health rather than institutional.
Correct. And if I may add just a couple points about that, the national average is, when you take the Medicaid budget that goes towards long-term services and supports, about 45% of the Medicaid budget goes towards home and community-based services. That's the national average. Louisiana is a little bit under 20%. So we're going the opposite direction from the rest of the country.
So and I think there was a congressional bill, I can't remember the name, maybe that actually kind of mandated this. We just haven't, right?
That's correct. The other thing I want to mention that I didn't get a chance to is that each member, I didn't pass these out, but each member on the committee has a number of individuals, obviously, that are waiting for services. I'm House District 61, Representative Marcel's district. In her district, 195 individuals are currently waiting for a Community Choices waiver. And each member on this committee has sometimes several hundred individuals that have been waiting up to 10 years, as Bobby mentioned. So it is a very serious problem. And 250 waiver slots doesn't eliminate the problem. It doesn't solve the problem, but it is a step in the right direction, and I think we can get there.
How many slots takes care of the problem?
Well, currently there are about 7,600 individuals that are on the wait list.
So we're trying to get 250 of 7,600.
Yes, sir. I want to give Susan Daigle a chance to read her testimony as well, if there are no other questions.
No, I'm good. Thank you, Mr. Chair.
Okay. And also, I think, is that Miss Susan?
Yes, Susan Daigle. Thank you very much. I guess I'm here to reiterate and reinforce what has just been said. I also am trying to support the 250 waivers for older people. And I think that it is very important for these people to be able to know that they are going to be able to stay in their home and not have to have going into a nursing home as their only choice. The amendment will help to assure that these people will get the right kind of care, people-oriented care, rather than the sometimes incompassionate and lacking in kindness that you get in the nursing homes. For me, I'm a home care, family caregiver, and the loss of financial security that faces me because of the time that I spend being a caregiver, and for so many other people that are in this situation, knowing that there is something that is there, that these people do not have to go to the nursing home and you do not have to stay with them night and day, is very reassuring, and it gives you an opportunity to do other things and maybe even get back into the paid workforce. I want to ask you that you would consider your own stake in aging. Long-term care will be necessary for most of us at some point in our lives, and the probability is only going to increase as the population ages. Do any of us really want to leave our homes, families, neighbors, friends, and risk the perils of an institution lacking compassion and kindness? I don't think so. So that is why I want to ask you to support the budget amendment. It's not the complete answer, but it will help as a foundation to broader delivery systems. But what I'm asking is that you can do all you can to create a life for our aging populations. It is the right and just thing to do, and I think it is a challenge worth embracing. Thank you.